today, what sectors within the life sciences demonstrate to you the most resilience in the face of inflationary pressure, global supply chain disruption? Are there any surprises? Are there any surprises that you didn't think about in your models 5 years ago?
Well, the answer to the last question is absolutely not. You know that's true because we destroy all the models that were wrong. We can't even find them anymore. No, those are good questions. I don't know how many things actually can dodge all of those, but the AI impact in our market is very real. There's a lot of data in scientific research, and the power of these tools to help organize that and prioritize, and mistakes that you made in the past to get immediately recalled. So it's going to be an impact in recruiting, but it's also a pretty big impact in marketing. I've seen some pretty amazing tools about how people are now able to find customers and reach out to them. I know you guys are doing interesting things in that area. So that's disruptive, and even recruiting, finding talent, it's all just been squeezed down to things that used to take a lot of time. We can do a lot faster, more efficiently. Areas that I think will see growth or didn't see decline. One example would be clinical. The rate of people being diagnosed with cancer is completely unaffected by everything we talked about for the last 30 minutes. And so for our portfolio companies that were targeted to that market, we saw a more consistent flow of revenues and demand. There might be less people willing to buy new equipment in a lab, but again, the demand for the tests and the assays is going to be more stable. Another area is this what's happening with precision medicine. It's a term that's been around for a long time. You're seeing a lot more. Some of this is the data generated, where a pathology lab maybe used to be a boring business, but now it could be a training model for AI that would really change the way care is delivered or patients are found and diagnoses are supported. So there's plenty of capital and demand going to that side. We see that's going to lead to more types of molecular testing, the sort of NGS in that area, as well as just in general all the other tools. And we've seen some pretty nice innovations in that area. Gene editing is an interesting one. This is one that's probably a more investable opportunity for us than most, because it has been really hit hard in the capital markets. So companies have raised lots of money and a lot of promise, and the investments have done poorly. But in the clinic, it's made great advances. It's rare to find that opportunity, right? Typically, it's often for the market to be out ahead of something, but usually in this case, it feels like it's gone so far, it's fallen behind. We're seeing in the cell therapy and gene therapy modalities, gene editing is a big part of it. They're finding new ways to deliver, new ways to QC it, more standardization around it, allowing for more progress in the clinic. But meanwhile, the perception is it's a bad market because, frankly, it's a little smaller than people thought. Is one of the issues, right? They got first-gen products onto the market in a CAR T that were really clunky, but they worked. And so the second-gen product's probably going to work better. It's probably going to be less expensive to make. But now you have all these companies that are worth a lot less than they were when the first gen was coming out. So that's something we really got our eyes on, whether it's as a service play or a tool or a reagent type play. And the last one would be, this goes back to changes at the NIH. There is a new division within it. There's a new prioritization. There's a new budget for getting into non-animal testing. This has been a long time coming. We'll continue to do testing on animals for toxicity. You're trying to measure efficacy in humans. But one area they highlighted was in monoclonal antibody testing. And it makes sense. You're using a human immune system to try to treat a human. Why is an animal really even involved in that process? But it was essentially mandated in a practical sense. And so to be able to come out and kind of go with more direct. Spheroids, organoids, these areas are going to grow quickly. It's a relatively small market, but the overall idea of predictive toxicology is a big market and has a lot of value. So we see that as an area that's been underinvested in historically. It's going to probably never kind of go back to the old ways.